Hello, everyone. This is Christine So. I'm the Executive Director of the Global Health Council. I want to welcome everyone to today's webinar. Today is the first of our Policy Scrum series for 2016. We do this series of policy discussions in advance of the World Health Assembly held by the World Health Organization in May 2016. Excuse me. So today's discussion will be on human resources for health as well as on research and development. Our speakers will be talking specifically about these areas as they relate to the upcoming WHA agenda. And we will be having further sessions in the Scrum series coming up over the coming weeks. We'll tell you more about that later on in the session. I want to particularly thank you for being part of this webinar that Global Health Council puts on. Global Health Council is the leading organization, membership organization that supports and connects advocates, implementers, and stakeholders around the world to prioritize investment and visibility of global health priorities. We engage at a number of levels, and this includes bringing a delegation to the World Health Assembly every year. So today's Scrum and the other Scrum discussions in the series are meant to serve as briefing opportunities for those who will be participating in our delegation to the World Health Assembly, but also for others who are interested in these topics and working in these topics. Please just take a moment to consult the Global Health Council website if you haven't already. And I will just underline that we are a membership organization and we would love to have you as a member if you are not yet a member. We have both organizational and individual members. So now to get started, I'm going to ask my colleague Liz Colway to give us an overview of today's webinar and some of the logistics associated with it. She will be introducing our speakers and then we will get started. Thanks very much.
Thanks so much, Christine. So just to reiterate, last year GHC launched its first World Health Assembly Policy Scrum series. So this is the second year that we're doing the series. Again, these webinars occur bi-weekly in the lead up to the World Health Assembly, which this year takes place starting on May 22nd. So each session really addresses about 2 or maybe 3 topics which are slated to be on the WHA agenda. And on this slide right here, I've listed the link to some important WHA documents. So I do encourage you guys to check it out, look at the agenda and other supporting documents that are there. And again, just to reemphasize what the purpose of the Scrums are, they really do provide a venue for the global health community to come together and discuss agenda items in detail, to ask questions to our speakers, and to determine next steps or action items if they do apply. So this is the agenda for today. Christine already did the welcome. I will speak about logistics in just a second, and then we will have 2 speakers joining us talking about human resources for health and research and development, and how those topics relate to agendas on the WHA agenda. And then in between each of those topics, we'll have a Q&A. So I do encourage everyone to submit questions throughout the session. And there is a chat box that is on the GoToWebinar panel that you can use to submit your questions. We do ask that when you are asking a question to please type your full name and organization in the chat box. It really provides a little bit more context to our speakers. So I just provided an example right there. Something else that I wanted to note is on most of the slides in the presentation, you'll notice at the bottom a Twitter handle and a couple of hashtags. So we do encourage you to join the online conversation about our policy scrums and continue that question or that conversation even after the scrum ends. Okay, so moving on to our first topic, we have Vince Blazer joining us from Frontline Health Workers Coalition. He's the director there, and the organization is an alliance of 34 US-based public and private organizations working together to urge greater and more strategic US investment in frontline health workers in developing countries as a cost-effective way to save lives and foster a healthier, safe, and more prosperous world. He is also the advocacy advisor for IntraHealth International, where the Frontline Health Workers Coalition Secretariat is housed. So thank you, Vince, for joining us, and I'll let you take it from here.
Great, thanks, Liz. Everybody can hear me okay? Liz, can you hear me okay?
Yes, we can.
Okay, great. So thanks everybody for joining today, and thanks so much, Liz and Christine, for inviting us to speak about human resources for health at the World Health Assembly this year. So Liz, maybe go to the next slide. So Liz already gave you the background about our coalition, and I think many of you on the webinar are probably already pretty familiar with the Frontline Health Workers Coalition and what we do, but we really try to highlight the impact that frontline health workers have across global health issue areas. So we work kind of across the spectrum of global health issue areas. And this first slide I put up, a same slide, similar slide that we had from last year, and I put up in a lot of presentations, just as really as a reminder of why health workforce strengthening is so critical to the progress that we want to achieve across really every issue in global health. These bullets here are just some of the main core issue areas that the U.S. government focuses on in its global health response. So whether it be maternal-child health, HIV/AIDS, family planning, sexual reproductive health, across the board, health workforce is a major barrier. Health workforce deficiencies are a major barrier to achieving the sort of progress that we want to achieve, and achieving the ambitious yet achievable goals that the U.S. government has set forth. And so that's really what our coalition's work focuses on. And of course, it's also issues that aren't listed here. Frontline health workers, clearly are very important for prevention and control of NCDs, for example. So we work across these issue areas, and it's critical that we focus on the workforce in order to achieve the progress in all of these areas of global health. So next slide. So kind of turning over to the WHO, sorry, 1 second, lost my slide. Turning over to background on the World Health Assembly and the workforce, the past decade, the World Health Organization and the Global Health Workforce Alliance have really focused, the efforts on health workforce have really been shaped through the Global Health Workforce Alliance. It received a 10-year mandate after the 2006 World Health Assembly and the Joint Learning Initiative on human resources for health, and there was a decade of action called for that. So the Global Health Workforce Alliance is one of those quasi-WHO organizations that's an independent body housed within WHO that given a mandate for driving action and advocacy on health workforce. So that mandate is coming to a close at this World Health Assembly, and so what's going to happen beyond the Global Health Workforce Alliance? They've already said that the operations are really formally going to be brought into the Health Workforce Department at the World Health Organization, but they are looking to create to harness some of the activities that they have worked on in the last 10 years to create this HRH advocacy network. Well, HRH network, it's beyond advocacy. So there was very recently a public consultation on this network, but a lot of what this network is going to be is still to be defined and developed. What we do know is it's not going to be, there's not going to be a funded secretariat with a mandate of working with civil society in the same way that the Global Health Workforce Alliance did. So what this HRH network will really be defined by the members and the work that's put into it. So it's a little to be defined and developed. The public consultation of that has closed for the network, but we've been in contact with the staff at the Global Health Workforce Alliance who are working on this, and I think they would still very much welcome thoughts to that. So if anybody wants connections to them, happy to do that. My email will be on the last slide here. So with the expiration of the Global Health Workforce Alliance's mandate, Frontline and others Frontline Health Workers Coalition and others really started pushing for a global strategy to drive health workforce policy and governance for the SDG period. And so that USAID took that up as a cause as well, and they pushed it within the Global Health Workforce Alliance board, and then HHS later at the World Health Assembly passed a resolution calling for a global HRH strategy, and so that strategy was mandated to be developed over this past year, and it's going to be voted on at the World Health Assembly this year. And so that is the key area that we're focusing on at the Assembly this coming year. So next slide. So this is from the Global Health Workforce Alliance, just showing the lengthy process that's gone into developing this global health workforce, global human resources for health strategy called Workforce 2030. It's been a more than 2-year process that started with consultations. Many expert groups were put together on various issues of human resources for health. The Global Health Workforce Alliance then compiled all of that, and the WHO took it and created a 0 draft of the strategy. There has been a public consultation, and then a new draft presented to the executive board in January. There's no more public consultations on the strategy until before the assembly. So you'll see on the slide of recommendations later, any efforts on trying to affect the language of the strategy will have to be done through member states at this point. So next slide. So wanted to provide a little context of how this Workforce 2030 strategy that's going to be voted on at the WHA is connected to the SDGs. In the SDGs that were approved last September, really workforce was critical throughout, especially the health goal, but even in a lot of the other SDG goals. But specifically 2 targets within the health goal. One on universal health coverage includes universal access to quality healthcare services. Obviously, to have universal access to quality healthcare services, you need access to health workers. So there's a big component of the UHC discussion and access to health workers. And then there's one specific to increasing the financing, recruitment, development, and retention of health workforce in developing countries, especially least developing countries and small and developing states. So those 2 targets are really the driving force behind this Workforce 2030 strategy, and also the strategies oriented toward reporting on these 2 targets. Now, just this last month, it was announced that the Secretary General of the UN announced there was a creation of a new UN Commission on Health Employment and Economic Growth, and that commission is chaired by President Hollande of France, and I'm forgetting the second one. I believe I don't want to get it wrong, but I don't know the other co-chair. But the that commission is going to deliver a report at the UN General Assembly, and it's going to and hopefully address one of the key questions that we really have remaining on about the Workforce 2030 strategy is how is HRH and Human Resources for Health going to be financed in the post-2015 period. And they're really also going to come up with a series of recommendations, best practices, evidence-based, and so that's something to watch in the coming year as well, and the link to what's happening in May to what's happened in New York in September. Okay, next slide. So this is just a little bit about what's in the Workforce 2030 strategy. I put a link to the strategy here, and I believe GHC is going to send these slides after the webinar is over. So you're welcome to use that link. So the overall goal of the strategy is to improve health, socioeconomic development, and socioeconomic development outcomes by ensuring universal availability, accessibility, acceptability, and quality of health workforce through adequate investments and implementation of effective policies at national, regional, and global levels. So what that really means is the strategy sets out a series of global milestones that all countries are expected to meet by 2030, and then those that all countries are expected to meet by 2020, and then those that all countries are expected to meet by 2030. And it also lays out the World Health Organization's role as a secretariat of this strategy to provide policy guidance, facilitate sharing of best practices, collect data, including on health worker attacks, but also on indicators in support of this strategy, among other activities. But the key questions that our members really had remaining on the strategy is, a strategy for human resources for health is really only going to be good as how well it's taken up by the strategies that exist in all of the other issue areas that we'll be, covering in the Scrum series. So, how is it linked to every woman, every child? How is it linked to UNAIDS 90-90-90? And how will those strategies take up this strategy, and how will this help improve to get the workforce needed to achieve all of those strategies? So that's a key remaining question. And of course, the big question always is on financing. Will this strategy be able to affect the financing, policy planning, for that matter, of human resources for health? So next slide. So I listed all the milestones here, so I'm not going to read all of them, but you can see that some of the milestones are pretty specific and measurable. So all countries, for example, all countries have a HRH unit with responsibility for development and monitoring of plans on HRH. That's a very specific piece. Accreditation mechanisms. Some are a little more wishy-washy, to be honest. The example of that, all countries are making progress on sharing data on HRH. So making progress really could be in the eye of the beholder. If you go to the next slide, the 2030 targets, you'll see even more, a few more of the wishy-washy making progress milestones. Now, those are done in part, to get agreement among all of the member states, and you can see they're on goals that are probably difficult for some countries to achieve. So the WHO Global Code of Practice is on migration of health workers. That's been a continued issue, which there's a lot of needed advocacy around. and having inequalities in access to a health worker. That's obviously a key goal, and one that would be great if was made a little less wishy-washy. But there are some really solid goals in here that aren't, like the 20% or less. Of all countries have reduced to 20% or less pre-qualification attrition rates in medical, nursing, and allied health professional training institutions. Okay, next slide. So the Workforce 2030 agenda is really the main focus of what we're looking at for the for World Health Assembly, but these are just a few of the other related agenda items that I saw on the agenda that we'll be keeping an eye on. But really, we keep an eye on the whole thing because so much of it is related to workforce. In the NCD area, there's some planning going around, it looks like, to the 2018 high-level meeting on NCDs. Of course, there's a strong link to workforce there, and so down the board, this past year, these past couple of years, because of the attention to workforce and the needs of local health workers in West Africa related to the Ebola response, we've paid a lot of attention to that and done a lot of advocacy around Ebola, so we'll be really paying attention to some of that follow-up as well. Next slide. So I've already kind of mentioned a lot of these, but just some ways to get involved is really we're kind of pivoting from trying to affect and improve the strategy as much as we can toward making people recognize the strategy and expressing support and kind of getting the strategy out there. But if there are major changes that you or your organization would like to see, the best way to do that is through the member state, is to advocate through the member state delegations at this point. That UN Commission I mentioned currently has a call out for contributions of evidence to help inform that commission, and the deadline for submissions to that is April 11th, so I included the link there, and that's a really great way to evidence that your organization or issue has could really be helpful for that commission. And then, the evolving HRH network, the Global Health Workforce Alliance is the best site to follow on that. And, ensuring you have a good background on the workforce area and that workforce is discussed and a central piece of all of the entire agenda at WHA, and you can find more information on that on our website. Some of the events that the Global Health Workforce Alliance is leading on, they're doing a closing out ceremony. There is going to be a technical session on the strategy itself that's, I believe, only for member states and those with the organizations with status with the WHO, but all of those events and times are still pending, so I'll be happy to share that with GHC as they come along. So that's last slide is just contact information of myself and Scott Weathers, our Global Policy Fellow. If you have any questions or want to know more about our coalition, which is also a membership alliance, feel free to contact us, and look forward to any questions anybody has. Thanks.
Great, thanks so much, Vince. And like I mentioned before, we're going to have a few minutes now for Q&A. So if you do have any questions, I just remind you to send them through the chat box on your GoToWebinar panel. And we'll give everyone just a minute or two to type out those questions. Thank you.
While we're waiting, I wanted to say the other co-chair of the UN Commission is Jacob Zuma of South Africa.
Okay, so since we don't have any questions at this time, I think we're going to move on to the next topic and then just take all questions for both topics at the end of the session. So with that, thank you again, Vince. And like I said, we'll probably come back to you with a few more questions at the end. So now we're going to move on to the topic of research and development and its role on, or its part of the WHA agenda. And we have Erin Will-Morton, who is the director of the Global Health Technologies Coalition, joining us. At GHTC, she develops and manages GHTC's policy, advocacy, and communications initiatives. Working with U.S. and international global health stakeholders, GHTC aims to sustain and strengthen investments in global health research and development. Erin is an expert in U.S. policy advocacy with experience managing diverse coalitions across the healthcare sector. So welcome, Erin. I'll hand it over to you.
Thanks, Liz, and thanks, Christine, for the invitation to present today and be a part of this policy scrum. I'm looking forward to heading to WHA with the Global Health Council again this year. And happy to be here to talk a little bit about where research and development is going to fit into the overall agenda for WHA this year. So next slide. I've picked out a couple of the key initiatives where research and development is a key part of the agenda for WHA. There are a number of other action plans and places where we're starting to see R&D be included, but as we have a short time today, I wanted to focus on these main issues that are on this slide. And they are the WHO Consultative Expert Working Group on Research and Development Financing and Coordination. Henceforth on this webinar, I will refer to it as the CEWG to save a few words here and there. The UN Secretary General's High-Level Panel on Access to Medicines, or HLP as we're calling it for short. Everything has to have an acronym in global health. And this, not as specific to WHO as it's driven by the UN Secretary General, but some really key pieces here that are important to focus on as it's part of the broader conversation. And then the rise of antimicrobial resistance and emerging and re-emerging infectious diseases as we start to hear more about Zika and look back on what happened with Ebola. Where does R&D fit in to all of that? Next slide. So we will start with the CEWG process. The WHO CEWG was formed actually back in 2010 as a way to better understand incentives for research and development to determine what role WHO could play in advancing global health R&D. They released a report in 2012 which identified three main opportunities for WHO to sort of undertake in R&D, and it was an R&D treaty, a pooled fund for R&D, and a global health observatory, which would establish R&D priorities for WHO. WHO then established a couple of demonstration projects around this pooled fund idea to evaluate potential initiative approaches and ways to finance and coordinate R&D across WHO. The observatory is actually being established now. However, the pooled fund concept is being discussed, and so this is one of the pooled fund for R&D is one of the key agenda items that GHTC has been tracking in the lead up to WHA this year. And so WHO's program, it's called TDR. It's the Special Program for Research and Training in Tropical Diseases. They are the ones taking the lead on developing the parameters for this pooled fund. They've hired McKinsey, actually, or hired them to do a landscape analysis over the last year to help sort of define these parameters. They did a bunch of stakeholder analysis, reached out to key players in the R&D space, both public and private sector, for-profit and not-for-profit. And McKinsey released or produced a report for WHO to help inform the details of this pooled fund concept. The report McKinsey report was not publicized by TDR, but TDR released its own report with an outline of recommendations based on the findings from McKinsey and the stakeholder analysis. And that report was just recently released on the TDR website. If you're interested, you can read all 76 pages of it. However, they do have a summary if you're more interested in the high-level notes on that. But essentially, the pooled fund would focus on raising new money for research and development for specific types of diseases, for type 1, type 2, and type 3 diseases as they're categorized by WHO. Type 1 diseases are those that occur in all countries, but where the R&D needs in developing countries are not being met at all. Type 2 diseases are things that are in all countries, but the disease burden is maybe greatest in poor countries. And then type 3 diseases are those that are really just found in developing countries, so where there's really no research and development being done. So TDR is in the process of sort of collecting some feedback on its plans. They are hosting an open-ended meeting, which is, I agree, kind of an interesting term for a meeting, but it's May 2nd through 4th. And in that meeting and discussion, they're planning to evaluate some of the recommendations in the lead up to WHO. And we had actually expected that the meeting was going to be in March, which was going to give us ample time between that meeting and WHA to sort of learn and hear some feedback about what had happened at the TDR meeting. But they've bumped the meeting back, so it'll be just a week or two before WHA. So we'll have not a lot of time at the conclusion of that meeting to determine whether or not there'll be some type of WHA resolution around the pooled fund. Specifically, TDR has recommended that the fund be around $100 million a year to support global health research and development, and that the portfolio be balanced between short-term projects that can sort of get up off the ground immediately, but also focus on some longer-term research and development efforts that might need basic research and discovery and therefore take longer and need a long-term investment strategy. They claim they want the fund to have transparent objectives and non-political evidence-based decision-making, and this comes back to what I was mentioning around the Global Health Observatory. There's hope that that observatory could help to make decisions around what diseases and what tools would be eligible for funding through the fund. And then the fourth recommendation from the report is that the fund should be able to accept new funders and maximize leverage by encouraging new participation and collaboration. And this is really in an effort to establish new money for R&D and to not pull from existing funds that go towards research and development. So GHTC has advocated for participation in this open-ended meeting. We went to the executive board, actually as part of the Global Health Council's delegation, to advocate that that meeting be open to CSOs. We've heard potentially that we will be able to participate for the first day to talk about some of the goals around the pooled fund, but we're still waiting for official invitation to find out sort of what CSO participation will be there. And then depending on the outcome of this meeting in early May, we could see an attempt at a resolution at WHA, although it's kind of become a controversial issue within the R&D community. There's really strong support for the pooled fund, but there's also some opposition to the pooled fund concept, sort of around some of the where is the money going to come from? Is it going to be new money? Could it potentially pull from bilateral funding? And what's the priority process going to look like? How is the money going to be allocated? And what's going to prioritize what disease gets funding and what tools and technologies are the focus of the fund? The U.S. government has already said that it would not agree to a treaty or mandate for the pooled fund, so they've sort of said they're not going to put money forward into a WHO pooled fund, which clearly makes fundraising for something like this challenging. U.S. support behind something like this would help a lot in getting other donors to put money forward, so that's one of the big challenges that we've seen to date. And I think that just goes to sort of the broader principles of not wanting to impact bilateral aid. And so it's a real challenge to advocate for funding to go to a pooled fund when we don't want it to be pulled from existing money that the U.S. government's already investing in research and development. So if you want, this is a sort of quick overview of what's happening with CEWG. If you're interested in more information, GHTC hosted a webinar last month with Rob Terry from the WHO and 2 of our members talking about the pros and cons of the pooled fund, and a great overview from Rob outlining how the fund would actually work. So it's on our website, ghtcoalition.org, if you're interested in learning more there. And then we'll go on to the next slide. The UN Secretary General's high-level panel on access to medicines. So this was established a couple of months ago with the proposed objective to review and assess proposals and recommend solutions for remedying the policy incoherence between the rights of inventors, international human rights law, trade rules, and public health in the context of health technologies. I did actually have to read that. I don't have their mandate memorized, but in a nutshell, the high-level panel was established to really look at the intersection between intellectual property and access to medicines. This has become an incredibly charged issue within the research and development community, and so while there's no specific WHO resolution proposed around the high-level panel, the fact that this is happening at the same time about this discussion around a pooled fund and within the broader context of research and development, it's really important, and I would expect a number of side events at WHA to focus on this issue, and for the sort of broader concept and topic of access to medicines to come up throughout a couple of other conversations. So that's why I highlighted, and we'll give you a quick overview of how the panel is operating. The panel has experts from a variety of countries. All of them are acting in their individual capacity. The list of panels is on the website, which I apologize is not on the slide, but it's unsgaccessmed.org. And so you can learn there more about the panel members. There's also an expert advisory group, which consists of a sort of broad list of experts from public sector, private sector, the academic sector, professional and civil society groups, and then patients as well. And again, all of these folks are serving in their private capacity to recommend and provide details and background to the actual members of the high-level panel. The panel sort of was founded based on some findings from the Global Commission on HIV and the Law, and it's, again, part of this is the impetus for establishing the panel was to really look into these issues and sort of intersection between access and IP, intellectual property, across a variety of health technologies, diagnostics, drugs, vaccines, other tools and technologies, not just medicine. The panel had an open call for contributions from the public. GHTC submitted comments to the panel, and our comments were specifically asking that the panel sort of broaden its thinking around access to medicines, that it's not just an issue of IP, but that there are a handful of other factors that come into play when you're talking about getting medications to people who need them. You can't just think about IP. There's a whole host of other challenges from the development of the product through the regulations and product approval process that need to be considered. The community that's going to be using the products all of that needs to be taken into consideration. So the comments from the public are available on the panel's website. There were 177 submissions, which I think the members of the high-level panel were surprised at how much traction the issue received and how many comments they got from the public. And the comments are very, very heated. There are very strong opinions on both sides of this debate. IP debate is central to the discussion. You know, there are comments from both private and for-profit sectors, and I think just goes to show how heated of a debate this is. The U.S. government has already expressed pretty serious concerns about the premise of the panel. sort of stating that, again, it needs to be more broadly thought of rather than just IP and access, and that there are other things that we might think about. And the U.S. government has a pretty strong position that you can't just throw out IP and create a whole new system. And so a lot of really fascinating conversation. The high-level panel held 2 dialogues earlier this month, one in London and one in Johannesburg. And the one in London, I think people felt was, quite one-sided, with representation a lot from patient advocacy organizations, and then the sort of complete opposite side from the public sector, commenting on the role specifically of IP in this debate. The conversation in Johannesburg, a little more balanced. The positions were presented well from both sides of the debate. A couple of new positions brought into the discussion around other things that access to medicine, the other challenges to access to medicines, sort of along the lines of our comments. Actually, we were able to get some of our main points and comments into that second conversation in Johannesburg, which was great. In a nutshell, the panel is expected to produce its report by June. It's an incredibly tight turnaround for any sort of UN initiative. And we expect that they'll stay on track at this point. And since the report will be June, WHA will happen just before that, but I expect, again, conversations to continue to happen there. And we're sort of staying tuned in terms of what conversations happen at WHA that could influence or delay the report in June of the high-level panel. And then following on to that, something potentially around UNGA in September once the report's been released in June. So again, not something for resolution at WHA, but something to keep in mind, as I think it plays into a lot of the broader conversations around research and development. Next slide. So just to wrap up here quickly on the research and development pieces of the agenda, antimicrobial resistance and emerging threats. So there was a resolution in May of 2014 around antimicrobial resistance, another one in 2015, and the 2015 resolution requires a meeting in 2016 at UNGA, so coming up this year, to sort of discuss what WHO should be doing or finalize a WHO plan around antimicrobial resistance. And certainly a huge part of antimicrobial resistance and the discussion is around the need for new tools, the need for R&D for new antibiotics to address these concerns around resistance. So very interested to see what happens at WHA this year in preparation for that 2016 dialogue at UNGA. The other place that AMR has come up is in this conversation around a pooled fund, the CEWG and the high-level panel, still sort of thinking about and talking about AMR as an issue and where research and development fits into that conversation. So again, these themes kind of running together throughout the conversation. And then, of course, with Zika and Ebola emerging, WHO has continued to keep these at the top of their list, certainly with declaring a public health emergency recently for Zika. I think WHO is on high alert based on some of the criticism received for the handling of the Ebola outbreak, and so has been sort of upfront in talking about how it's going to respond to the Zika outbreak. And there is not a specific resolution on the agenda yet, although I expect that that these issues will sort of be added to the conversation around broader emergency preparedness. Influenza was specifically addressed at the executive board meeting. That was kind of the only place where we saw this emerging infectious disease topic come up in terms of R&D, but again, I expect that to be broadened in advance of WHA as we think about how to respond to these emerging infectious diseases. And that's it for that slide. I think the next one's just my question slide. But I did just want to highlight quickly a shameless plug for the Global Health Technologies Coalition side event to WHA this year. We are hosting an event on Monday, May 23rd. The time's still being fleshed out. It's going to focus on some of these global health security, emerging infectious disease and pandemic issues, and sort of the intersection of R&D throughout this agenda. So highlighting a lot of the things that were covered here with some experts from WHO to talk about the role that they play. So I will share more information and details with Global Health Council as soon as we have them, and hopefully they can share that with everybody on the webinar today.
Great. Thanks, Sharon. We will start taking, again, some questions. If you do have any, again, just put them in the chat box and send them along to us. We did actually receive a few questions regarding human resources for health. So I'm going to see if maybe Vince can answer those while others come in about research and development. So Vince,
okay.
The first question, I'll just read it out loud for folks that aren't only joining us over the phone. The first one came from Nadia Cobb, who's the director for the University of Utah's Office for the Promotion of Global Health Equity. She thanked you for the good overview of the healthcare or frontline health workers scene. There'll be discussions about different workforces that serve primary care needs globally, like clinical officers, health assistants, etc. This was an area, she said, that Dr. Jim Campbell had noted as a need for defining in order to scale up workforce at the community level. Did you have any comments around that question?
Sure. Thanks, Nadia. Good to hear from you. Yeah, I mean, the short answer is I'm not sure how much. There's not a specific agenda item on that, but first, for others listening, Dr. Jim Campbell is the director of the Health Workforce Department at WHO and the executive director of the Global Health Workforce Alliance. So he is really the main driver and the main person in charge of all that we talked about in the HRH area. And there has been in both at WHO and in the UN discussions a lot, as many of you know, a lot more discussion about primary health care. The Gates Foundation has also become a lot more involved in primary health care in this past couple of years, and so it has come, I mean, things go full circle oftentimes in global health policy, but it has arisen high in the global health agenda again, and there's a lot of talk about clinical officers, health assistants, community health workers, other cadres of health workers, and I'm sure that that's going to be a big topic of the discussion around the Workforce 2030 strategy, and there are some items on that within the strategy itself. Now, beyond that, I'm not sure. One of the potential events that the Global Health Workforce Alliance had told me they were looking at was something on community-based practitioners, or community health workers, what we would call them, but WHO calls them community-based practitioners. But I don't know if that's going to end up happening or not, but I'm sure that the community level workforce is going to be a central discussion. I neglected to mention in the other agenda items, there is also an agenda item about the framework for people-centered health services. And that's a much broader framework that includes HRH, but is much beyond. It has a lot that goes beyond HRH. So that framework is really around that delivery of care at the community level, and that's really just a framework, as far as I can tell, a framework and best practices set for member states to try to follow for people-centered health services. So that is going to be an official agenda item during the WHA, so we look for that discussion to kind of address that issue. Do you want to read the second question, Liz?
Sure. So it came from Noella, who's an independent consultant. She's wondering if you know about a human resource for health initiative going on in Rwanda right now. She said it brings together U.S. institutions who strengthen training of health workforce. Financing is provided through existing health system strengthening activities. Do you know anything about that initiative?
I'm not extremely familiar with it, but I know that Rwanda has done a lot of work in the HRH area. Context of being a small country has the ability, I think, of being able to coordinate a lot more with the different entities involved. And I know a lot of our member organizations are working on health workforce in Rwanda. But if there's, Noel, if you have specific questions, I can help connect, or if you're working on it yourself and there's something valuable coming out of Rwanda that would help inform our advocacy, certainly welcome it.
Great, thanks so much. I'm going to give everyone just a few more minutes to type their questions out. We are getting a few questions just regarding links of items talked about today. And I just want to mention everyone on the webinar that this webinar is recorded. It will be available online on at globalhealth.org later this week. We'll also have a PDF of the slides presented. And I will go back and add in some of those links that were discussed today if they weren't already in the presentation. So hopefully you will be able to access all the documents that way. So since we didn't have any more questions coming in, I'm going to just go on to a few next steps leading up to WHA. So as we mentioned, this is a bi-weekly Policy Scrum webinar series. So our next Policy Scrum will take place on April 5th at 1 p.m. Washington, D.C. time. We're going to be we'll be talking about the topics of non-communicable diseases and aging, which are both topics slated to be on the WHA agenda this year. And as I mentioned before, the World Health Assembly will be starting May 22nd, and GHC is going to be bringing a delegation to WHA. We were admitting candidates for our delegation over the last few weeks. That process has now closed, but we will be contacting individuals by the end of next week, letting you know whether or not you made it onto the delegation. For those that are attending as part of another organization's delegation or are just interested in staying up to date with what's going on at WHA, We do have information that we'll be sending out. We'll probably be sending out a daily update during the actual assembly. And then prior, we have hotel room blocks available. We'll also be posting an online calendar of side events. And I think as Vince and Aaron mentioned, there are a lot of side events that are under development and haven't been finalized yet. But once we do get more details, we will post them on our website. So you can always visit globalhealth.org. And we also have a special web page just for WHA. It's /GHC WHA 69 here on the screen. And you can find all the details about our delegation and information about WHA there. And if you are hosting a side event, please consider sharing it with us. You can share it to the email address events@globalhealth.org. And if you are a GHC member, you're welcome to submit statements to us for review and possible inclusion in GHC's submission to the WHA official record. So I think that's it for next steps, and I'm going to just hand over the mic to Christine for a few closing words.
Thanks very much, Liz. I really want to thank our speakers today, Aaron and Vince, for sharing their information with us and for responding to questions. We're looking forward to the follow-up scrums that will be coming up over the next few weeks, and certainly we're looking forward to the World Health Assembly at the end of May. We will continue to share information about the Assembly, both leading up to it and while we are there and once we are back. We typically do a debrief with the Department of Health and Human Services following the Assembly, so please look forward to that in June as well. So with that, I'm going to wish everybody a good rest of their day. I know that many of us are very disturbed by what's happened in Brussels today, and so just asking everybody to stay safe and wishing you all peace for the rest of your day and the rest of the week. Thank you. Bye-bye.